Up next here this morning, thinking of plastic surgery, but worried how it'll turn out. We're going to show you a brand new option. You're watching The Early Show right here on CBS.
Welcome back to The Early Show. It is 8:19. If you're considering a little nip and tuck, but you're worried about how you might end up looking, a new machine is out that can show you the future of your face before you do anything to it. Here with the revolutionary VECTRA 3D machine is Dr. Monte Harris, who uses it in his practice. Good morning, Dr. Harris.
Good morning, Maggie.
Thank you for coming in. Monica is here as well to help us demonstrate how this machine works. So basically, what is this machine?
I know, it's really a phenomenal tool. It's like seeing is believing, because three-dimensional imaging is really going to play a larger role in our lives in the 21st century, and this takes sort of three-dimensional imaging into the facial plastic surgeon's office.
So she sits down in the chair, and this is like a camera that takes a 3D image of her, which is transferred to this screen.
Exactly. And you see
how do
here,
you use it?
You see here, it's a really cool image that we can rotate in a variety of different ways, and we're able to essentially redefine the way that I interact with my patients in the consultation process. So we can do things like rhinoplasty, sort of in office, even before the patient gets into the operating room.
This is what she looks like now. Show me and show Monica what she would look like if you did a rhinoplasty.
So a lot of times patients come in with ideas of sort of wanting refinement in the tip, and we're able to show changes that may be somewhat subtle. You can see the sort of tip coming in right here.
Okay. Yeah.
So that little bit of narrowing there. And it can be appropriate changes such as this, or ones that may be inappropriate like this. So it helps us set expectations ahead of time. Exactly.
All right. Let's say if you did a little work on her chin in addition to that, what would it look like?
Well, that's also, really exciting, because we're able to sort of show complementary procedures ahead of time. Things like chin augmentation, so you can see here with the little warp tool that we have here that I can isolate out the chin. Just like this. And we're able to sort of bring the chin forward into sort of a little bit more balance. We can do things like mini liposuction, in the office to further contour the neck. And then when we're able to review this, you can see before and after these changes, and we can rotate it in all the infinite possibilities so that we really get a good idea of how things are going to look beforehand to help ensure a successful surgical outcome.
And the patient has realistic expectations.
Yeah.
But I assume it puts more pressure on you, because you better live up to this.
Well, a lot of times when we talk about surgery going wrong, it's not because of technical problems, it's because of pure aesthetic judgment, even before we set foot into the operating room. So this helps sort of eliminate that.
Exactly. So a lot of people are still wary of plastic surgery, and I know that fillers are an alternative. Right. Can this machine show you how you would look with fillers?
And that's really very exciting, because fillers or volume changes are the rage now for plastic surgery, and that's injecting things that help folks look a little bit more youthful. So I can actually select a procedure with this tool, and we can do contouring.
Okay.
One of the areas that, when we talk about facial aging, gets a lot of attention is this idea of the mid-face, so that area
the cheek here, kind of get deflated a little bit, yeah.
So Monica doesn't really have sort of excessive signs of aging yet, but we can show here
I just gave her a thumbs up.
Yeah, we can show here that I can actually inflate, and deflate the cheek, but it shows that area where she may benefit.
When you get older, it could get kind of like this, and then what do you do to inflate it?
We can sort of lift it up. So, it's phenomenal to be able to take this into the office before surgery and really set realistic expectations between the patient and the surgeon.
Dr. Monte Harris, thank you. Monica, thanks so much.
Great, thank you.
You're welcome. For more on this, go to our website, earlyshow.cbsnews.com.